Hello and welcome to Health 247 on Rapid TV, your weekly window into trusted health insights, expert perspectives, and the stories that shape well-being across our communities. Today, we turn the spotlight on a growing emergency, Nigeria's worsening nutrition crisis. It is a situation affecting millions, stretching healthcare systems, and putting vulnerable children at severe risk. Stay with us as we break down the facts and explore the urgent steps needed to safeguard our future. I am Josephine Bitrus. Across the country, hunger and malnutrition have reached alarming levels. More than 31 million Nigerians in 26 states and the Federal Capital Territory are now facing crisis level or worse food insecurity, an increase of 22% from last year. The Northwest and Northeast remain the most affected, where conflict, climate shocks, and economic pressures continue to deepen food shortages. Among the hardest hit are children. About 3.5 million Nigerian children under 5 are severely acutely malnourished. Nearly 2 million of them are in the Northwest and Northeast. And an estimated 400,000 are at imminent risk due to critical shortages in life-saving nutrition supplies unless urgent action is taken. This crisis is being driven by a dangerous mix: persistent insecurity, rising inflation, climate-related disruptions, and weakened livelihoods. Together, they are pushing more families to the brink. Health 247 examines the state of the crisis and the nationwide efforts underway to confront it. Nigeria is confronting a national emergency as food insecurity and malnutrition intensify. On 14 April 2025, President Bola Ahmed Tinubu announced a state of emergency on food security, pointing to soaring food prices, widespread hunger, and acute malnutrition. He placed the National Security Council in charge of food and water security and urged humanitarian partners to boost support for government's response. According to the Integrated Food Security Phase Classification (IPC) Acute Malnutrition Analysis covering May 2024 to April 2025, about 5.4 million children in the Northeast and Northwest regions are malnourished. About 1.8 million children are severely malnourished, and another 3.6 million are moderately malnourished. Roughly 800,000 pregnant or lactating women are also affected. Disturbingly, 63% of local government areas in the Northeast and Northwest are in serious or critical malnutrition phases. Despite the scale of the crisis, only 20% of affected children receive the treatment they need, and malnutrition accounts for 45% of all deaths among children under 5. The Nutrition 774 initiative is a government-led program in Nigeria that targets malnutrition across all 774 local government areas. Launched in February 2025, it aims to strengthen food security, health, education, and nutrition with a particular focus on vulnerable groups such as children under 5 and women. The initiative seeks to unite all sectors under a single plan and strategy, ensuring coordinated efforts to combat malnutrition nationwide.
Nutrition 774 initiative is a grassroots initiative. It's people-centered, government-led. The whole idea of the N774 is not that it's a project or a program, but a framework, a movement to allow for a unified response to tackling malnutrition in the country. There's been a lot of good work and efforts by both government in previous administration, development partners, donor organization, civil society, private sector. But a lot of times, the work that is being done is done in silos, right? And so, what these initiatives aim to do is to, one, bring a multi sectoral coordination and collaboration. So, we have one plan, one strategy for tackling malnutrition in the country. Number two is to drive political will, which is very critical, to make sure that at the various tiers of government, whether it's federal, state, or local government, that the leaders actually act on their commitment. One, prioritize nutrition, release the funds for nutrition, back it up with evidence-based around data, such that they can be held accountable for those commitments made. And then also to ensure that we focus on high impact interventions. Nutrition has so many interventions, but there are limited resources, as we know, financial resources in the country. So how do we prioritize where we'll have the best buys, whatever interventions that we focus on, and to make sure that it trickles down to the grassroots beyond Abuja, but that communities can actually feel the impact. And that's why I said it's people-centered, grassroots, bottom-top approach.
Sustainable financing is essential for nutrition programs. How does the government plan to guarantee its security?
So, for sustainable financing, we cannot continue to depend on donor organizations. We're aware of recent fund cuts, even by the US government, and as a country, we must take ownership. So, what we plan to do is, or what we're driving for political will around, is to improve domestic financing. What this renewed hope agenda, of course, under the leadership of President Bola Ahmed Tinubu, and with the Vice President, Sir Kashim Shettima, serving as the chairman of the National Council on Nutrition, what we're doing is to ensure that we put nutrition in the front burner, in the front lines of the national agenda, create the visibility for it, but also, like you said, the financing. So when we go from state to state, and also using the National Economic Council platform, we advocate for increased financing within the budget lines, but not just the appropriation, but the release of the funds, because if the funds are not made available for these interventions, then it becomes empty promises. So that domestic financing is one critical way. In March, the National Council on Nutrition also endorsed a nutrition intervention fund, which is supposed to act as a catalytic funding to where government puts down seed funding, and then we can pull in funds from development partners and donor organizations. There are also conversations around innovative financing of perhaps using tax, like the sugar, sweetened beverage taxes, but those are still in conversations. But again, we must take ownership of our own financing, and the support coming from partners will be more of support rather than the major financing for nutrition in the country.
Community leaders and traditional rulers are vital for advancing nutrition in Nigeria. Their impact includes shaping food-related customs and cultural norms, championing nutrition policies and programs, and rallying communities to adopt healthier habits, among other things.
Oh wow! Community leaders, traditional leaders, they are critical. Their role is vital. In fact, without them, this initiative will not succeed, because they're the critical voices, trusted voices of the people. When someone goes to their imam or to their pastor or to the traditional leader, they're most likely going to hear and listen to them and obey their instructions. So we need them as partners in this fight against malnutrition. They can help debunk myths around breastfeeding, or maybe children having access to drinking water and all of that. It's very critical. So we need them to really drive the message to help with the behavioral change aspect for nutrition activities at the grassroots. They're critical to this journey and in this war against malnutrition. Media is critical. I know I said traditional leaders are critical, but media equally so, because you are the people that bring about the visibility of what's working and what isn't. So if the media is able to portray that the Masaki program in Jigawa has yielded XYZ result with evidence-based statistics, then a state like Zamfara can say, I can learn from this and tailor to my own cultural needs. The media, you're the voice, and you can also hold government accountable, not just federal government, but the subnationals as well, to say, well, you had promised under the N774 in August that you will deliver 1, 2, 3. Now we're 6 months down the line. Here are the questions. So your voices as media is critical in ensuring that our children are properly fed, get access to the right nutritious food, and of course that the grassroots truly take ownership of this initiative.
Over 31 million Nigerians in 26 states, plus the FCT, are now dealing with even worse food insecurity, a 22% rise from last year. The hardest hit are children. About 3.5 million are severely acutely malnourished, with roughly 2 million of them in the northwest and northeast, and an estimated 400,000 on the brink because life-saving nutrition supplies are running critically low unless something changes fast.
The truth is, food insecurity, poverty, those are critical drivers of malnutrition. And to speak actively on what government is doing is one, government identifies that those do exist, so we're not in denial. But one aspect is, you mentioned the issue of RUTFs, ready to use therapeutic foods, right? To ensure that these are accessible and affordable. How do we do it is by encouraging local production rather than importation of these RUTFs. So that's very critical. There's been distribution, for instance, by the Federal Ministry of Health and Social Welfare of commodities like multiple micronutrient supplements. Again, more can be done, but government is very aware that these are critical. So you have the immediate reliefs, like I said, providing these RUTFs and multiple micronutrient supplements, but also the long term, which is where the Nutrition 774 comes in. Is about systems. How do we, while we're mopping up the floor, solving the issue of acute malnutrition, we're also turning off the tap to see that we don't have more children falling into severely acute malnutrition cases. And this is where institutionalization, building, strengthening the systems around not just health, but food systems, education, social protection, water, sanitation, and hygiene. And again, that's where the N774 comes on, bringing all these various sectors together to work collaboratively, but listening first and with that cultural context of what's happening at the grassroots, because Nigeria is like 36 countries in one. And so you have to make sure that our solutions are tailored to what the people need, because what you might think as a solution in Jigawa is very different as a solution in Imo State, where I come from. So government, through the N774, ensuring that we really listen to the people, so that influences the policies that we will set up in the federal government or in Abuja, because the war against malnutrition cannot be won from Abuja. It has to be done at the family level, and which is where us as Nigerians culturally we're the strongest. Our family unit, that whole bottom-top approach is the way to go.
The creation of state councils of nutrition, pledges from local government chairmen in Jigawa, and the setup of nutrition departments within various ministries are among the steps already taken to address Nigeria's nutrition crisis.
The N774 is really more like a movement to drive political will, improve financing, data and accountability. It was launched February 2025, and specifically so during the National Economic Council meeting, which rarely happens. This is where the 36 state governors plus one sit and make decisions. So really bringing that to the limelight, as a development challenge. And so creating that political visibility is key. So we've been going from state to state since August this year. We've visited 10 states so far, and some of the wins there, apart from establishment of the State Council on Nutrition, tangibly we've seen an increase in release of funds. I'll give you an instance. In Cross River, the funds, there's been an increase from 48 million naira to 154 million naira. This is within 3 months of visiting. So it creates, like I said, that visibility and drives that political commitment by the governors with measurable, actionable steps. There's also been a commitment by local government chairman in Jigawa, I think 13 million naira monthly that they've committed to tackling the malnutrition through their Masaki program. Again, that's unique to Jigawa, right? They've developed their own program that works for them. We've also seen renovations of creches, which is necessary to encourage exclusive breastfeeding in Abia State and Cross River as well. There's also been a call for nutrition experts being pulled into the civil service system, and of course establishment of nutrition departments across the various ministries, which will allow for a budget line to be able to implement nutrition interventions. These are just a few of the wins that we've already seen, like I said, within 3 months to 4 months, and we're hoping to see more. Next steps would be to cover more states, but also continue with the peer learning with the states visited. What has worked for state A, what has worked for state B. I forgot to mention through to the Child Nutrition Fund, which is propagated by UNICEF, but also in the support of Gates Foundation and a couple of others. There's been a release of funds. Zamfara, for instance, released 500 million naira for a match funding with UNICEF. So how that works is for every $1 government brings, there's a counterpart funding or match funding of another dollar. I believe Jigawa released 250 million as well. So this would help increase the funding available for nutrition and would help with implementation. So the next steps is really to continue with the drive for the political will, the establishment of the Nutrition Intervention Fund to allow for more funds as innovative financing, which will be result-oriented, result-based. So for states that are doing well, they get more money to do more. Driving ownership at the subnational level is key. Private sector is also critical. And so there are plans on the way to pull in private sector, not just for CSR, but to take a look at their manufacturing of fortified foods, right, staple foods, so that we can get these nutrients into our households and for our children to be able to grow, learn, and thrive.
Undoubtedly, data is crucial in tackling malnutrition as it tracks progress and evaluates interventions.
Without data, we're running blind. We can't say what we're doing well, where we would need to improve. So we identify, this administration understands that it's as critical as even the coordination itself. The central one is domiciled in the Ministry of Budget and Economic Planning, which is by policy the coordinating ministry for nutrition in the country. And of course, that's cascaded also at the state level. Budget and Planning does the same thing. And so the whole idea is we have a dashboard now, and when states sort of collect and collate their results and information, they're able to feed it through a backbone from local government to states, through the SCFN as well, and then to the national, where at the end of the day, the vice president and chairman of the National Council on Nutrition can sit and see how the states are performing, then in turn go through the neck and say, well, I won't mention any state, but this state you need to do well, this state you need to improve. That's the whole idea. Of course, there are gaps, and we're working closely with the technical expertise of development partners. They've been really supportive to close those gaps and to strengthen and institutionalize what we're doing and the gains that we've had so far.
Addressing malnutrition cannot be left to the government alone. It requires a collective effort.
My final words to Nigerians would be tackling malnutrition is not for government alone. It is one that requires our collective effort, from the mothers to the leaders at the community level, families. Everybody must come together. There must be that ownership by the people to stand and say, you know what, malnutrition has no place. So We're talking about activities, even homestead gardening. What are we doing to ensure that at the back of your house you've planted a few things rather than waiting for government to do a palliative, right? Government will do its own bit, and that's the commitment, that's the promise from President Bola Ahmed Tinubu. But it takes a collective effort, private sector, civil society organizations, media, development partners, and of course with government really providing that guidance for how we would move. And so we can tackle this. If there's any country that has the ability to fight malnutrition, is Nigeria, because we are blessed not just in natural resources, but we are blessed with human resources as well. And so we have what it takes. We just need to work collaboratively together to tackle this issue.
Experts warn that despite some isolated gains, Nigeria still faces alarming levels of food insecurity, especially among children and vulnerable households. Thank you for staying with us. Nigeria's nutrition crisis demands a coordinated and comprehensive response. Immediate food assistance is essential, especially for children under 5, as well as pregnant and lactating women. Strengthening healthcare systems, improving access to treatment for malnutrition, and expanding community education on breastfeeding, nutrition, and child care are also critical. Government action must align with community participation. Effective policies, adequate funding, and stronger partnerships will pave the way, while empowered communities drive sustainable change from the ground up. And that's our package for today on Health 247. Join us next week for another edition. Until then, eat well, stay healthy, and take care.